Hello, everyone, and welcome to this audio podcast. This audio podcast synopses. This audio podcast synopses as part of a Speckle report. This audio podcast as part of a Heighe this audio podcast as part of a Heighe Bedlam. This audio podcast as part of a Bedlam Plexar, and this audio podcast in this audio podcast synopses an overview in around education, looking at peer reviewed and published works from 2021. Peer reviewed and published works from 2021, looking at education, empowerment, and practice excellence, and sort of practice review works from 2021. And the synopsis in around this as thus is as thus. Online portals and spaces have allowed patients with long-term condition or long-standing conditions to access supplementary information relating or regarding health and disease through a range of modalities. The wealth of information available online for patients is vast, but much of it can be daunting and also lead to misinformation. Patients with long-standing conditions need to be directed to modalities that are appropriate for needs and support for patients with long-standing conditions from healthcare professionals can be multifaceted, and patients benefit from scheduling. Patients can benefit can find it advantageous when scheduling time with allied health professionals who are trained to provide remote education services. So, for example, chronic kidney disease patients might find education on the reasoning behind frequent blood tests and investigations helpful. Such an initiative would be supplementary to care as part of electronic patient records. And since 2009, the RPSG or social media platform has a standing history of offering evidence-based educational support for patients and healthcare professionals across social media, and an established portal. Online portals can improve patient documentation by facilitating more complete records to be kept with fewer errors, alongside improving the ease and efficacy on behalf of health professionals maintaining the records. In around this peer reviewed and published works from 2021, the reviews seeks to highlight whether it might be advantageous to involve multidisciplinary teams in online consultations and or educational sort of sessions through the RPSG platform. And the works in this works and there is in this works there is some overview looking to understand if it would be helpful to have follow-up consultations where following or subsequent to patients having appointments, for example, that patients have access to healthcare professionals and through online consultations and through multidisciplinary teams, access to multidisciplinary teams for and as part of healthcare as part of healthcare. In this as part of this sort of overview to inform that there has been an audio podcast that goes over this works in a previous sort of overview as part of a Storm Robotics production. In this series or this audio podcast as part of the Speckle report, this works a peer review publication from 2021 will be put forward in parts so that listeners can get a sort of a more a more sort of hopefully more in depth understanding of this peer reviewed and published works. In around some looking at some terminologies to identify sort of similar works. Similar works include include chronic kidney disease, patient education, electronic patient records, patient assessment, and online portals. That draws this audio podcast synopses to a close. This audio podcast is part of a Speckle report. This audio podcast as part of a Heighe Bedlam. This audio podcast as part of a Bedlam Plexar, and this audio podcast as part of a Storm Robotics production.